Hello, this is Pam. Today we're going to be talking about the symptoms of parasites. Never in a million years did I ever think I would be doing a Facebook Live talking about the symptoms of parasites, but I can speak on this topic because of the experience that I've had personally, but also in the experience of the many wellness champions that I've coached. We've had over 600 students work with us in the Live Disease Free Academy, and we have seen a lot of parasites. It's shocking. So the symptoms of parasites, this is something that the general population is just starting to gain interest in this, because a lot of us have these symptoms that come and go. We may have been dealing with symptoms for years, and we want to get to the root cause, but we're not getting anywhere with our standard of care because they're not trained in recognizing parasites or treating parasites at this time, which is a real shame. It's a skill that's been lost. Just want to say hello to a few people. Hi, Lainey and Rudy and Stephanie and Maureen and Tiana. I think I said your name correctly. So the topic today is the symptoms of parasites. And this affects all of us to some degree, even young children, adults, whether we have a chronic disease label or whether we consider ourselves healthy, because some of the biggest reasons are because most of us have been on antibiotics at some point in our life. And we're exposed to parasites all the time. We can't avoid them. It's just part of life. But for some strange reason, we deworm our pets because they get parasites, but for some reason we don't get parasites, and nothing could be farther from the truth. And because we have not been managing parasites inside of us, they've kind of gotten out of control for a lot of us, and they're a really big factor in chronic disease. So what is a parasite? A parasite is something, it's an organism that lives off of a host. So for example, a worm that we would get possibly in our intestines, it lives off of us. We are the host. And if we, let's say, have one worm, then we might get a little bit of, a little cramp once in a while, stomach pain, etc. But we're pretty much healthy. Maybe our bowel movements are still regular. But it's the balance part. It's when we have an infestation of parasites and multiple different types of parasites. This is when we really run into problems and we start to get different disease labels. So with all chronic disease, parasites are a really big factor, and we have to get this information out because it's so simple to, it does take work, but it's definitely doable to treat them. So you've probably seen some information out there talking about, worms are immune modulating and it's good to have them, and people that suffer with MS, it's good to give us these worms and it helps to modulate our immune system, because our immune system is the problem. Our immune system is attacking our tissue. It's making us sick. Again, complete error in that way of thinking, because when you look at those studies, when they give people these, I think they're pig whipworms, after a while they're saying, please take these worms out of me. I have so much stomach pain. So that is not the answer. And again, if worms are helpful, why do we deworm our pets and our animals, right? If they're helpful, we would not deworm them, but they cause disease for various reasons. When you're looking at just worms, because this is such a huge topic, I'm going to pick one area today. I'm going to talk more about like worms and protozoa, which are single cell parasites, and we'll talk about fungi on it, fungus like candida and yeast and other fungi on another Facebook Live. And then we'll also talk about the bacteria associated with Lyme disease on a different one, the symptoms. So today the symptoms we'll talk more about what kind of symptoms would we expect when we would have worms, and big and small, and protozoa. But in fact, when we talk about parasites can be bacterial. They can also be, they're called helminths, and helminths are worms. They can be flatworms, which would be like flukes. They can be roundworms, which would be the nematodes, and they can be tapeworms, which are disgusting. Right? So we have bacteria and we have these helminths, and they estimate, just so you can see how big this is, could be between 75,000 to 300,000 different types of helminths, different types of worms that can cause disease in vertebrates. So any organism that has a spinal cord, like humans and fish and birds, etc. So there are thousands of different worms that can be a problem as far as being a parasite. And we're just going to focus on a few little ones here, but you're going to get the gist of just how significant this is to our health. So we have the bacteria, and I'll mention the protozoa, which are the single-celled, things like amoeba and giardia and plasmodium, like these single-cell little parasites. And we'll talk about what they're linked with, but they're very small and they can cause a lot of problem inside of us too. So we have, again, the bacteria, the protozoa, the helminth, and these ectoparasites, so the parasites that live outside of us, so things like mites and ticks and fleas, those, I'm not going to talk about them today, and fungi. Fungus is also a parasite. All of these things, all of these different types of microbes, they live off of us. They eat our food. They need us to live, right? Whether it's us or different hosts, but they need hosts to live, and that's why they're called a parasite. So with respect to parasites and with respect to the symptoms, let's just talk about there's a lot of symptoms. So, and it's the reason that there are so many symptoms is because if you just think about the worms, right? If there are thousands of different types of worms that could cause a problem in us, we could be infected with them. And we know that different types of parasites like to live in different parts of the body. Some like to live in the eye, some like the central nervous system, some like the reproductive part, some like the gut, the intestines, some make their way out into the liver, to the gallbladder, to the kidneys. So joints, for example. So this is why we have such a variety of symptoms, and it really depends on which parasites we have. And if you've watched any of my previous videos, I was diagnosed with multiple sclerosis 30 years ago. And by the grace of God and a lot of hard work on my part, I learned very early on that the multiple sclerosis was caused by infections. I didn't know everything I know today, but I knew to start with fungus, treating fungus, and that's what I started working on. And yes, I did treat parasites, but I had no idea, because in the early days we used herbs, and they're very limited in what the recovery out from parasites, especially with the big parasites, especially when they're deep-rooted in your body. But what we have learned in coaching 600 people through the Live Disease-Free Academy is really shocking. Like, I have hundreds of pictures of parasites, which is amazing. And it's really opened my eyes and helped me to understand the sicker we are, the more infested we are with a variety of parasites and fungus, yes, and bacterial infections. But today we're just talking about the worms and protozoa. So the protozoa, again, are single-celled, little tiny, they're much smaller than the worms, but they still live off of us and they still cause a lot of damage. So some symptoms, let's talk about general symptoms. Maybe some of you guys can relate. Hopefully you can't, but it's pretty common that we can relate. So extreme fatigue and mood swings, depression, anxiety, and rage, like where people just have a really hard time regulating their emotion, and they can just go from 0 to full-on rage in a really fast time. Dark circles under your eyes, often just feeling like you're not feeling well, drooling at night, grinding your teeth at night, coughing at night, night sweats. A lot of women think that their night sweats are caused by menopause, and in fact, it is caused by parasites, even very small ones like Babesia. Some of the Lyme infections, the very small ones, they can cause different types, or they can cause the night sweats. Seizures, right? They have been really linked to a parasite in the brain. Chronic anemia, where your blood iron is really low. Yes, if you have a lot of bleeding with your menses, with your periods, you can definitely lose iron. And that, of course, is caused by infections also. And yes, iron is deficient in a lot of our produce today, but we know that different types of parasites inside of us, they take a lot of iron from us and we become anemic. Nail biting, hair loss, obesity, terrible cravings like food addictions, and just being overweight. Then if we look at the head, so we talked already about the mood swings and the rage and all of those things. I forgot to mention general is allergies, food allergies and sensitivities really involved with parasites. So it's not just that we have a leaky gut because of the parasites and we have inflammation in our gut, but also they are incredibly linked with food allergies and sensitivities. So to continue on with things that go on in our head, so we can have a foggy head, memory issues, and then I mentioned anxiety is a really big part. People just feel like they can't cope. And this is really interesting, mental illness. So just in the last few years, there's been studies linking schizophrenia, bipolar disorder, suicidal tendencies with a specific, and there can be other parasites, I'm sure, but one specific parasite that they found is a protozoa, a very small single-celled parasite called toxoplasmosis. Shocking. And it isn't shocking to me. It makes sense. Like our body knows how to run properly. And what we have to do is figure out what's interfering. And what we teach is it's either infections, right? And toxins, and most of the toxins would be caused by these infections. And we'll talk about those too. Like, how could these different infections, even in the gut, how can they affect our brain so much where we feel so depressed or we have so much anxiety? There are many mechanisms that take place as far as, you know, exhausting our adrenals, etc., and we end up with low thyroid, but also things like chemicals that are produced would be like lots of ammonia. Like some of these parasites can produce tons of ammonia, amphetamine and morphine-like substances, and acetaldehyde, which is a neurotoxin, formaldehyde. If we just look at Candida, we're talking about worms right now, but Candida can produce over 70 poisons. So with these different parasites, we have to remember the reason that they affect us is, number one, they eat our nutrients that our body has worked so hard to digest, right, and to bring into our blood. So whether they're taking it out of the bloodstream or taking it out of the intestines, they're making us deficient in certain nutrients. They deposit their waste in us, which contains a lot of different toxins that I just mentioned a few, plus not just the toxins, but they have their own microbes. They have their own bacteria and fungus and viruses inside of them. So they're infecting us. And the work of Dr. Alan MacDonald, he's a pathologist, and he found in every single person that he tested, 10 people that died from multiple sclerosis, in every single case, he found many nematodes, small roundworms in their spinal fluid and their brain, but more in their spinal fluid. And those worms were loaded with Borrelia, which is Lyme disease. So these little worms were bringing Lyme disease into the brain of people that suffer with MS. So it's not bad enough to have these worms in our central nervous system, but they're also bringing in other bacteria. And so the same is in our gut. They will, we know of another different types of these small filarial worms. They require another bacteria, which is Rickettsia, which is another one of the Lyme bugs. And with the combination of the two, like if we treat the bacteria, it's really more helpful to treat the worms. But it's really important to understand this is just the little that we know. They can be infecting us with so many other types of parasites and bacteria, etc. So they eat our food, they infect us, they give us a bunch of toxins and poisons, and they cause inflammation. They cause an immune response. Our immune system is fighting them. They are the enemy. They're trying to get them out. And so we have symptoms. We have all kinds of different symptoms. The pain, all of the inflammation symptoms. That is our immune system fighting these parasites. So again, with the head, I forgot to mention migraines. So the migraines are also caused by parasites. I think I've covered everything else there, and the schizophrenia. So going on to the body symptoms. So this is where we can have pain. We can have pain in our muscles, in our joints, in our head. We can have swelling and edema. Maybe we have swollen ankles, swollen feet, muscle twitching. and blurred vision or blindness. Some of these different worms love to move into the eyes and love to live there. And so we can have blurred vision or blindness. Rashes, different parts of our body. We know that even little nematodes can live on our skin. Kidney pain, gallbladder pain, liver pain, they move into our organs. And I did mention the work of Dr. Alan MacDonald. So the relevance of what he found, those little worms in the central nervous system of people that suffer with MS, I just want to share a few symptoms with you when these worms are in animals, domestic animals like dogs, cats, horses, cattle, sheep, etc. This is what veterinarians have known for 100 years. They have symptoms identical to multiple sclerosis. So things like extreme fatigue and depression, general weakness, tingling, numbness, dizziness, lack of coordination, loss of balance, blindness, muscle stiffness or spasms, spasticity, drop foot, scoliosis, which is the curvature of the spine, seizures, weight loss, and paralysis. When you look at that list of symptoms, it is really, really shocking because those symptoms are so characteristic of not just MS, but also many other neurological diseases. And you'd wonder why in 100 years, if they've known that when animals have these nematodes in their central nervous system, they suffer with all the symptoms that we do when we have neurological diseases. Why didn't they make that connection? I don't know. And that's a topic for another date. So then if we look at, okay, I already mentioned about the Borrelia, how it hides in those little microfilarial worms or filarial worms that get into the central nervous system, and they are depositing their waste, so they're infecting us with Lyme. There's other studies I've shared on other previous Facebook Lives where if we have tapeworms in our intestines, the little immature forms are called larvae, and sometimes they make their way out of the intestines and they make their way into different parts of the body. They can get into the liver and they can cause this, a lot of times cysts form. A lot of research is starting to show that in the center of tumors, there's also a parasite, and also getting across the central nervous system. And there's studies where they have found a lesion or a couple of lesions, and they found it was caused by the larva of a tapeworm, and it was causing relapsing remitting symptoms in somebody, mimicking MS, multiple sclerosis. So it's just shocking that, and they're finding with people that have back pain, yes, if you've injured your back, that's different. But there are a lot of people that have back pain and it's caused by parasites. The parasites, they're finding them even in their bone marrow, little worms in their bone marrow. It's so simple, right? It makes so much sense. I want you guys to type in your questions if you have any questions for me. And I'm just wrapping it up here. So as far as digestive tract, this is where we really understand the symptoms of parasites, because that's what we would equate to parasites, that they would just be in the intestines. But a lot of times they move out. Most of the parasites are not living in the intestines if we've had them for a few years. But when they are in the intestines, we have things like abdominal pain, cramping, constipation, diarrhea, bloating, and sometimes with the diarrhea we could have blood or mucus, and distended belly, irritable bowel syndrome, colitis. Those are just a few of the symptoms. So again, this is by no means a full survey of all the symptoms, but it really helps you to see that it's not just fungus, because a lot of us for many years we thought candida is everything. And even I did, because that's what the practitioners were telling us at that time. That was the extent of their knowledge. And yeah, parasites might be a problem, but you take some wormwood and black walnut and cloves, etc., and you should be able to deal with it. Well, we found with our students that it's not enough, that you have to treat with the anti-parasitic drugs. And again, the anti-parasitic drugs are not perfect by themselves. So we use layering. We will use anti-parasitic treatments, we will use oxidizing agents, oxygen type therapies, and then layering herbs. And diet is huge, because if you stop feeding them, that really helps a lot. So I'm going to see if you guys have any questions. And before I go to the questions, you guys go ahead and type your questions. I just wanted to share a few successes. I love sharing just a few successes that came in yesterday. So yesterday we had our Live Disease Free Academy class, and people report their improvements. So we have quite a few new students that are just starting right now. They're starting to implement the eating plan. They're starting to decrease the carbohydrates. And if you want to know more about the eating plan, I've got some videos on YouTube and on Facebook, Live Disease Free. So we have a YouTube channel, also Live Disease Free. And you can learn about how we're eating. It makes a huge difference, because as you greatly reduce the food to those infections, people start to have symptom relief because those infections are not as active anymore. And then we support the body, and then we start to look at our symptoms, and then we start to treat. So this first success that came in, and I saw her picture. She sent me a picture. It was a 7-inch worm, and it looked more like a little bit like a tapeworm. It was kind of twisted, but 7 inches, and that is not the biggest we've seen, but that is still pretty significant. And she said, I passed a 7-inch worm, and I did feel better after passing it. Today, I had 2 pieces of the same, and I finished the anti-parasitic treatment. So she's on her first treatment cycle. She has multiple sclerosis, and she's noticing that, so she finished the meds on Sunday, and she's still passing the worms. So exciting. After I do pass the worms, I can walk without my cane for a few hours. So this is really significant, right? Like when you do that, you're passing the worms and you have that much of a shift just in the first treatment cycle, you know you're onto something. And she is so incredibly excited. So this next student is very new. She's following the eating plan stage. And she's found, so what we do is we help them to follow the eating plan, but also to make sure we're having daily bowel movements, because we want to support the body, and making sure they're sleeping at least 8 hours a night or more if they need it. And she said, I'm now sleeping an average of 7 to 9 hours. My energy levels are higher. I'm able to stand on my legs for a bit longer. My sister noticed that I can walk more straight. I'm doing more things with my children. Cooking is easier. And the little jobs around the house, such as washing, etc. So this is just from changing her diet and starting to support her body. I now have times where my brain fog has improved a lot. I'm able to see more clearly, and my cognitive function is better too. Woohoo! Small improvements, but a big difference for me. It's motivating me to keep going. And then this student, all of these are anonymous just because they're brand new students, and I don't have, I just want to keep their identity sealed. But we do have, if you want to see other people that are sharing their successes, make sure to go onto Facebook and YouTube. Then you will see people that have been through the program, and I've interviewed them, and you can hear them talking about their experiences. It's super exciting. So this student she's finished her first treatment cycle, and she has noticed that she's been able to walk without her, I think it's a scooter or wheelchair, but she's still using it. She's not totally better, but she's definitely, her mobility has improved significantly. And she shared yesterday, this is another thing, this for us women that suffer with PMS, it is from these infections, and very often parasites are a really big part of it, not just Candida. Yesterday my period started right on time, the first time in years. I used to have PMS symptoms. I went to 4 different doctors. I requested blood work, hormone panels, help, and got none. One finally said yes and ordered routine labs and said I was fine. And another said it was mental and I should go and get some counseling. Yesterday, my period started and I felt great. I was able to go shopping by myself for 2 hours and not feel tired afterward. I was able to try clothes on without being dizzy or feeling worn out. And before going shopping, I went for blood work. So what we do is after we finish a treatment cycle, we do the blood work, just check everything's good, and then we go on to another treatment cycle. We like to take a break in between too, so that the parasites think that the pressure is off. They think they can just come out from their hiding places, and then we hit them again. And she shared that when she went for the blood work, she had a smile on her face and a great attitude. So for people that have chronic disease, that have been basically had their independence really decreased or lost their independence, things like this are so much fun when you can go out shopping by yourself and feeling great. And another student shared that this is a brand new student, again, just following the eating plan. So we follow the eating plan. So we greatly reduce the food to the infections. We support the body. We look at symptoms. Then we start to build a game plan. And if we have a lot of parasite symptoms, we start hitting the parasites first. So this student, again, is just at the prep phase, getting ready. And she's noticed an increase in energy this week. And I haven't gone out with my hubby for dinner. Say that again. I went out for dinner with my hubby last night after a day's work, which we haven't been able to do since I became sick. That makes me and my husband so very happy. Awesome. And then last couple here. So this student has just finished her first treatment cycle, and she does have multiple sclerosis. She shared, my husband did notice last night that my pace of walking has picked up, which is really nice to hear. She also shared that her spasms, those horrible leg cramp spasms, are gone. And she just spent 30 minutes outside in this gorgeous sunny day and working out 30 minutes a day now because her knee is totally healed. Her energy level is up, which is such a blessing. And then one or two last ones here. So this gentleman is just following the eating plan, again, has multiple sclerosis. And he shared the eating plan is going great and the cravings for sugar have really slowed down. Brain fog has been going away and my anxiety is almost completely gone. My strength is starting to return. Like, how powerful just with changing your diet. So, if that's the first place you start, you've got to start. Start by changing your diet. That's not going to get rid of the parasites, but it's definitely going to decrease your symptoms and make you feel better because those parasites are kind of being put on a fast and they don't like that, but we still have to treat them, but it's definitely the first step. And then the last one I wanted to share here, another student that's just following the eating plan. These are all newer students. I have been feeling better since I've been following the eating plan. I no longer feel tired and I'm not hurting anymore. I'm able to walk better. My balance is not off anymore. And I can see and feel a change already. Awesome that my body is responding this way. I feel good. So this is what you can do with just the start, right? And then we have other students that I shared last week that are going back to work, right? So they've been treating a few cycles. But what we find is that if you have a chronic disease label, then you have quite an infestation of parasites, and it will take at least 4 to 6 or more treatment cycles to get better. And if you want to ask me, like, what treatments are we using? That's really hard to say because within our students, like, we have at least 60 to 70 students in our class in many different countries. People that have MS, it's not a cookie cutter recovery, unfortunately. It depends on, yes, there might be 1 or 2 parasites that are similar, but also, where did you travel? Did you live on a farm? What animals were you exposed to? Where did you eat your food in restaurants? Like, did somebody infect, like they went to the bathroom and they're carrying parasites and they passed it on to you? Everywhere, handles, door handles. We're exposed to parasites all the time. And so what we're seeing with our students is that the treatments do vary. And that is why you have to work with somebody. And that's what we help people in the Live Disease Free Academy, is we help people to, number one, prepare for treatment, and then to build a treatment plan and to monitor them through it, to help them through it, because this is really new and we are working hard to build a network of practitioners, but it's going to take time because this is so new for a lot of practitioners. So I'm going to see if you guys have any questions for me. All right. Hello, Lisa. I never know if I'm starting at the right end here. So Denise, some nights you feel less spasticity and you have more energy. Why do you think this only happens occasionally? So when you're starting with this whole program, when you're so infested with parasites and let's say you do some things that are correct. You are not feeding them as much, so they're more quiet. You're maybe getting a little bit more sleep, so you're feeling a little bit better. But what can happen is we might accidentally eat something that's a little bit more higher carb, or it may have some hidden ingredient that we didn't know, like fillers or sugars, things like that. It could be sometimes when our symptoms are a little stronger that maybe we're working on a virus. Maybe we didn't sleep as well the night before. So it is bumpy at the beginning. What our students do is they just know that they'll be starting to implement and they'll be like, it's working. I'm starting to feel better. Oh my gosh, this is so exciting. And then they won't feel as well for a day or two. But it's like this in the beginning because you're so infested. But as you really get through the prep part, and if people follow it well, they do have significant improvements, small, like not huge yet. It's not like they can get out of a wheelchair. And I can never promise that either, but we do have that happen. So the key is to understand that you just keep taking the right steps. You just prepare yourself. And then when you get to the treatment part, that's where you start to really notice things can change really quickly. So I shared one student last week. She did 2 treatment cycles. She's a very good implementer. That is really important. Like my students that are like 100% implementing, they're the ones that recover the quickest. And for her, after 2 cycles, like she couldn't type before. She can type again. She can do squats. She can lift weights. She can walk for 2 miles. She can walk her dog, and she's going back to work. And that is the shocking reality, is when you have the right treatments. And the only way that we found that is how we do this, is that we actually got samples. She got tested to see which ones were the most helpful. She got a prescription, and away she goes to treat. So again, when you have a lot of infection, when you have a lot of parasites, it's up and down at the beginning. And then as you decrease the burden by treating them, then you'll notice, Denise, that you'll be able to have more consistency with the improvements. Okay, so Catherine, I don't understand how you can eat out following the eating plan. Actually, it's really easy. I have to travel sometimes to go to different workshops. A lot of the restaurants are changing their menus. So there are a lot of people that are eating keto, and we don't follow a keto diet. But so what I do is I will look for grilled vegetables or steamed vegetables and some kind of grilled meat, and then also a salad. And on the salad, I'll say, please hold the cheese, please no fruit. I would just like some some olive oil, because we're lucky if we can get extra virgin olive oil, but I'd like some olive oil and a piece of lemon or lime. And just make sure you get enough fat. So sometimes I'll even say, do you have any butter? And I'll put some extra butter on my steak, or just make sure you have enough healthy fat, because that's really what keeps you satisfied. Enough vegetable servings, enough protein, and enough healthy fat. So it's actually quite easy to eat out. For breakfast, I just really would do like 2 eggs over easy, so that I know what it's just eggs. It's not like something else mixed in with beaten eggs. A lot of times they'll have some greens. So I'll ask, can you just, like if you're at a buffet kind of thing where they're making the eggs, you can just, drop a couple of eggs in and swirl it around and add different vegetables, etc. So it's pretty simple, but you just have to be thinking ahead and making sure that you ask the right questions. And I always give a little bit of an extra tip, because I appreciate them going and caring and just making sure that I eat the right foods. So it's pretty easy nowadays, way easier than even things like Boston pizza. You can go there and you can get a piece of salmon or a steak, and you can get steamed vegetables, and you can get some salad. And then you can just have some olive oil. You can bring your own olive oil in your purse if you want some high quality extra virgin olive oil. And they usually have lemon or lime pieces too. So Tiana, how can someone become a student? That's great. Good question. So all you do is watch my masterclass training. There will be a link in the feed of this video or above the video. And it is how to recover from MS naturally. And it's not just for MS, but I speak to MS because I had multiple sclerosis 30 years ago, and I've been MS free for 30 years. but I attract a lot of people that suffer with MS. But this is true for all chronic disease, or even if you don't have chronic disease, but you've got like maybe pre-autoimmune symptoms and you're just like, something's wrong and I don't know what it is, but I just need to deal with it. So watch the masterclass training, and if you're ready, then you can book a time with me. You can get started right away. And I would love to support you. So Elaine, can I start the anti-parasitic drugs before I start the enemas? So with the program, what we do is we first have to follow the eating plan really well. If you are still feeding, if you're getting too many grams of carbs, we find that the drugs don't work as well. I know this because I've been working with a lot of people, and I've had a couple of students that were following the eating plan really well, supporting the body, feeling so much better, taking the anti-parasitic drugs, feeling even better, and then, oh, you know what, I'm on these drugs, it'll take care of it, so I'll just have this little cheat. And it's like, they felt terrible. So that is the key, is we have to remember that, number one, the drugs are not perfect, and that's why we have to cycle through quite a few times, and we have to use strategy, and we have to layer. So what we do is normally eating plan, support the body, and then we do use an oxidizing agent. If students want to, they can do enemas, which will help to clear some of the parasites out of the large intestines. And so it's not something that's mandatory, Elaine, but it's something that is very helpful to have that going even before you start the anti-parasitic drugs. But the other part is important, supporting the body and through the checklist for healing, but also to follow the eating plan. So Maureen, at the beginning, is anyone else terrified if they have a setback or if they feel awful or worse? It's very different when you're treating parasites. So we find that the anti-parasitic drugs are tolerated a lot better than the herbs. With herbs, a lot of people are sensitive to them. And I think it probably has to do with the fact that the herbs are probably not strong enough for some of those parasites that are causing really bad symptoms in us. So when we take the herbs, it aggravates them, and it makes them, when they're aggravated, then we are suffering. And so when we're taking these treatments and we're doing them in a very safe manner and a gradual manner, people just feel better and better and better, and they tolerate them really worse. So no. And again, Maureen, we're not just sick people taking a pill. That is not the right way to think. We have to, first of all, like, stop feeding them, start feeling a little better, right? And support the body and feel a little better, right? And then you start treating. So it is very important, again, to support the body first. I think that's really, really important. You're very welcome, Tiana. Please reach out. I'd love to support you. It's a life-changing experience. It'll change your life for the rest of your life. And hi, Quiche, I think that's how to pronounce your name. What foods should we eliminate immediately? Sugar is the big one. The parasites, all of the different parasites, whether it's bacteria, fungus, worms, protozoa, one of the primary fuel is sugar and simple carbohydrates, and even processed carbs like breads and baked goods, all of it. All of the carbs, the starchy grains, etc., they break down to glucose in our body, and that is the primary fuel for these microbes. They love it. So what we're doing is we're going really low carb, below 50 total grams of carbs per day. The sweet spot seems to be between 35 to 40 total grams of carbs per day. So we're still eating tons of vegetables. Our plates are 80% full of vegetables, low carb vegetables. So we're not having the corn and the potatoes or the sweet potatoes. We're not having those, but we're having lots of different greens. And I talk about those on a couple of videos. So make sure to watch those on YouTube and Facebook, Live Disease Free. But the key is to get the carbohydrates down, to get the healthy fats up, to have moderate amounts of protein to keep our muscle mass, to keep our brain functioning nice and clear. But that's the gist of it. So we're off of all grains, we're off of dairy, and we're, of course, gluten-free because we're not having any grains, very limited fruit, and very limited nuts and seeds, lots of vegetables, unprocessed meats, so things that we know what's in it. There's no room for error where somebody forgot to tell us that there's some kind of sugar filler in it. And the herbs, things like the basil and thyme and oregano and ginger, so all of those beautiful herbs, garlic, and all of the lovely oil. So it's a very healthy and tasty way of eating, very satisfying. You just have to make sure you have enough calories per day if you want to keep your weight on. It's easy to do, but the key is you feel a lot better when you start to decrease the food to those infections. They become a lot more quiet. So hopefully that gives you some ideas. And what about fake sugar? So we would avoid all fake sugar. The only thing, if you want to have gum that has xylitol, just for occasional is fine, but we avoid all sweets because we want to be free of the addictions. When we've had all these parasites, they make us crave sugar like a drug addiction. And some people have really serious sugar addictions. So as you're coming off of that, and you don't want to be having sweet things in your mouth because then you will keep your sweet tooth. So we want to get rid of our sweet tooth so that you can be out later once you're recovered, like me. Just had our Canadian Thanksgiving holiday spent a wonderful, wonderful weekend with family. And they had dessert and I didn't, and it doesn't bother me. It does not bother me at all. I don't feel like I'm missing out. And I'm so grateful that I don't have that vice, because otherwise I know that the next day I wouldn't feel as well, right? Because I had MS. I don't have the luxury of messing around. I want to make sure that I manage my microbes and keep the good ones up and the bad ones down. So avoid fake sugar, especially things like aspartame. It's really, really unhealthy. The sugar, even xylitol, having large amounts of the alcohol sugars can be irritating to your gut. And then stevia, a lot of the stevias are laced with sugar. And again, and stevia has a very different taste. It's not enjoyable. And again, you want freedom from the sweet tooth. Helen, water, kefir, kombucha, and beet kvass, beneficial to us with MS symptoms. With respect to the fermented foods, in the recovery phase, the only one we would have is the raw sauerkraut. We avoid all other different fermented foods. So things like kombucha, that's from tea, so there could possibly be caffeine in it, and we do avoid caffeine. And it is a sugar ferment, right? And so kefirs, things like that, there can be natural yeast in many different fermented foods. So we just stick with the raw sauerkraut. Homemade is always the best for sure. And then once you're well, once you've treated these infections for several months and you feel like amazing, you can test different fermented foods and see if it agrees with you. But we have to get people to a place where they're actually feeling like that they've recovered. And then if you test something and you still have a little bit of symptoms, then you know that you've got more work to do. So, hi, Helen. I would like my weight to come off. So following this eating plan, the bonus is just your weight just melts off if you want it to. It's just an extra, we don't focus on that, but it's an extra bonus. And for people that don't want to lose weight, I share and I teach them how to maintain their weight. You just have to eat more calories. So it's all about calories. You're very welcome, Keish. How can someone hypnotize me so that I don't have this sugar addiction? So Catherine, if you have a sugar addiction, it means that you still have parasites you need to treat. That is why you have such a sugar addiction. So yes, sugar is addictive, but honestly, these infections make you crave it. And you have to remember that every time you're eating tons of sugar, every time you binge, you are feeding the infections that are making you disabled. So think of it that way. That is pretty powerful. So just think, and if you need to go back and look at some of my videos, I've got videos on some of the worms that my students have passed if you want to look at them. that might help you also. So we find that with our students that have severe addictions, they really have to work on their mindset at the beginning. They really have to, because many of us have been sick for so long and we've really lost that zest for life, we've lost our hope, we've lost our vision, we don't see a bright future for ourselves. So number one, the first thing is to be able to truly believe that you are going to beat this, that you are going to treat these infections. And you do that through listening to the successes of other people. You lean on their successes, the wellness champions. That's why go to my website, livediseasefree.com. There's a bunch there. Go to Facebook and YouTube, Live Disease Free. We're starting to put some up there. But their successes that's what's going to give you hope. And so then when my students start and they start to change the eating plan, they start to put triggers around their house. They put pictures of themselves when they used to feel good, when they used to be an athlete, when they used to feel like themselves, and they were doing the things they love to do. And so when you really believe that this is possible for you, you really know in your heart of hearts that you have a second chance, that you can have your life back, then that is what pushes you. When you have a clear intention and your why you have to do this is very strong, it pushes you through the hard 10 days. It's not very long. About 10 days and the worst of the sugar addictions are over. And you might still crave a little bit more, but as you treat these infections, that goes away totally. And then after a few years, if you're as diehard as I am, then you don't even want it because it tastes sickeningly sweet. Like it's just a nice piece of fruit, like a peach, that's different. But to eat cake, and no, it's just totally different. It just does not taste like it used to. So getting rid of your sweet tooth, I just shared that, Kennedy, and it's easy to do. Like, it does take a little bit of mindset work. Again, Helen, I would avoid the monk fruit. You're sick for, I don't know if you're sick, but I'm assuming that you're listening to me and you probably have health issues. So when we have poor health, it's not just the antibiotics, but it's also what we have been putting in our body. So what we want to do is we have to decide what's important to us. For me, running around with my grandkids, my grandchildren and my children, and just being active with them and being active with my husband, being able to do whatever I want to do, that is so much more important. When you go on this journey to become a wellness champion, your values change. There are other things that are far more important in your life. Your taste buds change also. Hi, Pauline. So avoid monk fruit. Avoid sweet things, Helen. So Marie Zena, I'll just do a couple more questions here. Is raw sauerkraut the same as unpasteurized? Yes. So when something is pasteurized, it's cooked, and that kills all the good microbes. So we want, the best is homemade, because then you can take organic vegetables, so they have not been sprayed, so they have more diversity of microbes on them. And then what you can do is you ferment them, and that multiplies the microbes in, and the homemade tastes absolutely the best, for sure. But if you don't have enough time, you can definitely find it in a refrigerated section of a grocery store or a health food store. Yes, sugar is a huge problem. Sugar is in everything, Catherine. It's hidden, and that's why, like, we eat food, like we buy all our vegetables. We're getting to the end of the season, but we buy all our vegetables from a local farm. We don't go into the big stores, and we're just picking meat that is not processed in any way. And we buy a few nuts and seeds that are just raw. So that is the only way that you can get away from all of this laced sugar that is in all of our food. All right. We do avoid balsamic vinegar, Garrett, because balsamic vinegar has a lot of yeast byproducts in it from the fermentation and sugar. So we definitely would not. I personally, if you're recovering, I would strongly advise just to have fresh lemon and fresh lime juice. That is my favorite. If you really need the occasional vinegar, apple cider vinegar is the only vinegar. Ramona, all you have to do is go back. There will be a recording of this. You can listen to the beginning. Pauline, is it sugar that would cause the cranial nerve to hurt worse than carbs? No, I think that the sugar activates the bacterial or parasitic infections that are there beside the nerve, which causes more inflammation, right? It makes them more, just think, it makes us hyper, makes children hyper, it makes these microbes more active too. And when they're more active, there is more the immune system is trying to deal with them more, right? So that's what would cause the inflammation for sure. And so the carbohydrates, they break down to sugars, just so you know that. So the breads, the grains, the potato, the corn, all of that breaks down into simple sugars. And the simple sugars in our body that our body is digesting would be feeding the infections, the parasites. You have lupus and Lyme disease, Helen. That is caused by infections. And if you treat the infections, you don't have to live with that anymore. So if you're ready, make sure to watch my masterclass training and you can start to treat this year. And it will take a few months, but people can notice improvements week by week by week. So Kilwana, you researched and you found some online supplements for killing. Yes, there are lots of herbs for sure. And you can go into health food stores. There's things like black walnut. And again, if you're on any medication or you have any medical condition, you have to check with practitioners. Don't just start taking herbs because they are medicine. And things like wormwood, you don't take them for long periods of time. You have to take breaks. So again, wormwood, black walnut, cloves are just 3 common herbs that you will find in parasite blends. But you can take them and you may see some parasites coming out. We have had students doing that, but we found that it's not enough to recover. That it's just not treating the parasites in the blood, in the central nervous system, the bigger worms, it's not touching them. So that is the problem. And there's a lot of different things that you'll see online, but trust me, we've tried pretty much all of them, and we know there's zappers, there's all kinds of things, and most of them, there is no, I love frequency, like there's the Rife, there's zappers, etc. But we have found that they're not strong enough to help people recover. You can do them in conjunction if you're working with someone and you're working safely, absolutely, but by themselves, they're definitely not strong enough. Is there a list of foods on the website that would be a daily reminder? What I would do is just watch not my masterclass training, but a couple of videos I have on YouTube and on Facebook, what I eat for breakfast, dinner, and supper, and also the best MS diet. It's not just for MS, it's for anyone dealing with chronic disease. So watch those videos, and that gives you the highlights. So Helen, when we join, are the drug cycle medications sent to us internationally? So this is where, if you work in Canada, if you live in Canada or the United States, I help you find a practitioner, or you can work with our practitioner. We do have a medically trained doctor that is monitoring students that want to work with him. So he's amazing. And so you're more than welcome to work with him, or I can help you find. There are other practitioners out there also that will help. It's hard to find them. And then as far as the treatments, the doctor would write a prescription, and then the prescription would go to a pharmacy, and we're working with specific pharmacies that carry these treatments, that have, they've been working with doctors that have been prescribing them for years, so they're very comfortable. The prices are very low compared to if you just went to a local pharmacy, because they don't carry it, and they're like, oh, we'll see if we can get it in. Okay, that'll be $7,000 for a treatment, where working with our pharmacies, it might be like $100 for the treatment kind of thing. So it's a huge, huge difference. And it's just ridiculous. This is, like we're treating our dogs and our cats and our horses and our cattle and all of our animals, but we make such a big deal of treating parasites in humans, which is awful. And that's why we're so sick. How do you get your doc on board with this? How do you get these anti-parasites? And that is the biggest problem right now, Wendy, is that in most countries, in most developed countries, Europe, Canada, United States, Australia, New Zealand, what my students find most of the time is that their doctors are like, oh, you think you have parasites? Let's do a stool test. The stool test comes back, you don't have parasites. You don't have parasites. And they, like in Canada, I've met with several doctors here, young doctors, and they said their hands are really tied. If they do a stool test and it comes back negative, they are not allowed to prescribe anti-parasitic drugs. It's almost like there's this rap, like, to keep it under control, because if we treated parasites, we would not have all of these big sickness industries. And I really believe that that's what's happened. The doctors don't know that, but I think that somewhere along the chain line, they do know that. And that's why the doctors have not been trained. And so you have to remember too, that GPs, they have their comfort zone. Every day they're seeing patients, and it's usually fairly similar things they're dealing with. So they're used to using certain antibiotics, they're used to doing certain procedures. That's their comfort zone. And so a lot of them are not willing to go out of their comfort zone. They can be ostracized from their peers, and they just want to keep things safe and simple, and they have busy lives. So that's the dilemma that we're dealing with right now, and it's really hard. We do have a practitioners members area, so with our students, when we're finding practitioners, then we're sharing everything, like we want this to get out. Really, my biggest thing is that I need to be out speaking more. I need to be out speaking more at different conferences, right, with sharing what we're doing and what we're seeing, because I'm not going to say I'm the only one doing this. I have learned from a handful of practitioners, but they're very low in numbers. So this, although maybe 50 years ago they understood how we really had to deworm families. Like when I grew up on the farm, 6 kids, the doctors dewormed us. And it wasn't perfect. It wasn't like as sophisticated as now, but they did that. But maybe it was one time, and it obviously was not enough. So unfortunately, it's really hard to get. You probably won't get your GP on board. Definitely not a neurologist for sure. Hi, Lisa. Hi, Kilwana and Bryce. Hi, Allison. You are also diabetic, and some of the symptoms of MS are the same. Will the program benefit me? Yes. We've had a number of students that have MS and diabetes, and just even following the eating plan, they didn't have to use their medication. So this is where I don't tell you to stop using medication, whatever you're using to manage the diabetes, but you'll notice working with your doctor that you won't need your medicine. There's not a single person that I've worked with that has diabetes that still needed to use their medicine after. And that is just because diabetes is also an infectious disease. So diabetes and MS are very common, not very common, but very often, or quite often, in conjunction. Catherine, if you cure the patient, you're out of business. That's what they think. I know. I'm not sure what happened. It's really sad, because I'm not against pharmaceuticals. Obviously, we're using them to treat parasites, but something's gone really wrong. Something has gone really, really wrong. And, you know, I can't do this by myself. And that is why we have an army of 600 wellness champions that are really starting to work together. There we go with thank you for the love. So really helping me to get the word out. And what you can do is you can help get the word out. You can share these videos. So important, especially when you've had, and you know, when you're a wellness champion and you've gone through the program, put your story, your success out. It just gives people so much hope. And that is the exciting thing, is that we have so many wellness champions now. We can go a lot faster. We are working together. and we are going to bring change. And if you want to be a wellness champion, if you want to be part of the leaders, the trailblazers, the forward thinkers, the people that are helping to bring such needed change, then watch my masterclass training. And if you're ready to treat these infections, and join up and become a wellness champion, and I'm excited to support you. So with that, I'm going to let you guys go. Next week, I'm going to be talking about the symptoms of fungus, because this is a really big part of chronic disease also. We know that fungus really suppresses our immune system, and so it's really important to recognize when we have fungal overgrowth in our body. A lot of times we can avoid a lot of these big tests, even just, I've been sharing a lot of these parasite symptoms. When you have a lot of them, you just have to treat them, right? That's the key. So thank you for spending this time with me. It means a lot to me. And we'll see you next week, 5 o'clock Pacific on Tuesday. No, sorry, backtrack. Next week, I have to do a call. So I'm busy next week, but the week after, I will be doing the Facebook Live on the symptoms of fungus. So till we meet again, take care and bye-bye for now.